we are, except there are good people like you talking.
Thank you.
Dylan's actually going to talk about that.
Yeah, and you've actually brought up something else that I wanted to talk about, which was the fact that the measles is coming back. There are reports about it coming up all over the world. And I think it's really important that, we've talked about the biology of vaccines and we've talked about the history of vaccines, and those are very important. But what's more important is what's happening with vaccines now, because it's driving this really, really combative dialogue in our country and abroad. And it's really important that we focus on what our solution is. We're aiming to protect kids. And so one of the issues we've run into is that we've had a lot of problems convincing people that we're all on the same page and that we're all kind of tackling the same goals. And that's not just a fault of the people in the community that are hesitant about vaccines. It's also a problem with scientists and doctors. We haven't done a very good job of communicating it. So just to give you some context, I want to talk a little bit more about what has happened with measles in recent years, or in this case, months. And before I do that, I just want to talk a little bit about measles transmissibility. We talked about kind of the negative effects it can have on your health, but I want to talk about how it spreads. And it's really one of the most infectious diseases out there. If one person has measles, there is a 90% of the people around them are likely to contract measles. That's because the virus lives 2 hours in the air, all by itself. And the infection window is very large. It's 8 days, and noticeably 4 of those are before any of the severe symptoms ever show up. And lastly, I want to show you kind of the range. Measles, coughed or sneezed out, can expand out to 6 feet. I could infect Safina and Brianna right now, no problem. And so I want you to keep that in mind. I want you to keep in mind kind of the transmissibility that we're talking about while we go through some examples where measles have cropped up in the news. And we'll start right at home, right in Stapleton. So on January 16th, a number of news outlets reported that there was a measles outbreak in Denver. Luckily, this was a measles outbreak of 1. There was one individual who traveled internationally. He came back to Stapleton, and we now know kind of what his range was during the time that he was infected. Here are the locations that are at risk. Blue Creek Therapeutic Health Spa in a 4-hour window on Thursday. King Soopers, Stapleton, just a couple blocks down. When's the last time you went through a King Soopers and stayed more than 6 feet away from everyone around you? It's impossible. And then he was home Friday, and then to the hospital. And so I hope this highlights 2 things. One is that this disease can catch up with you. It can sneak up on you. This was a person who was going to spas and grocery stores and then had to go to the hospital. The second thing I want to show is kind of where he was going. This is right in our hometown. Luckily, that was the only case, and this is a vaccine success story. One person got the measles from somewhere else, came into our community, nobody caught it. That's awesome. That's fantastic. And one of the reasons is because, 1, he was going to places where most of the people are adults, right? And vaccination rates are higher among adults than our young ones. Secondly, though, we have pretty good vaccination rates in our neighborhood. The Denver local area has vaccination rates around 95% and exemption rates around less than 1%. So that's really good. Unfortunately, that's not the only story that's been coming out of the United States lately. We've also been getting stories out of the Washington, Oregon area. Mm-hmm.
He also was not vaccinated.
He was not vaccinated, that's correct. Yeah. That's very important, yes.
He's that less than 1%.
Yeah. Now, if we talk about some of the other issues that have been coming up, and we really talk about this herd immunity, and this herd immunity is a great thing, that we have 90% vaccination and most people are healthy. However, it's important to remember that the data that we collect isn't necessarily at the scale that a disease cares about. And I want to bring you to this idea of hotspots. And this is the idea that if we look at a very large area, we can see very good vaccination rates. But it's not like all of the unvaccinated people are evenly distributed through our population, right? And the reason for that is because vaccination is a very personal choice. It's a choice that you make about your child. And when you're making a choice about your child, who do you talk to? Your friends, your family, people in your community. And that's where we get these hotspots. So as an example, I want to show you some counties in Oregon. Here is their county vaccination rate. Mostly around 90%, all great. But if we look at the K-12 schools that have the lowest rates of vaccination in those counties, 50%, 20%, 30%. This means that if measles happens to get into one of these communities, it's then spreading among a large number of people that are also not vaccinated. We don't have the herd immunity in those little pockets. That means two things. One is that the risk of an outbreak is larger, and the second is that those outbreaks are going to devastate communities. This is a local problem, and we've seen how it's evolved in Washington. So Clark County, Washington has a vaccination rate of 75% as of 2018. We now, from a single case, have developed 63 cases of measles in that county. 55 of them were unvaccinated. 6 of them we don't have the immunization record, so we can't say one way or the other. 2 received a single injection instead of the recommended 2 doses of the MMR vaccine. That's the difference of a 93 to 97% rate. And like Brianna said, there is a chance that maybe these people just had the vaccine fail. But we've got to consider who this is affecting. It's affecting kids. It's affecting school districts. And noticeably, this is the parents' choice, right? Whether to vaccinate their kids or not. Since the outbreak, since the choice before them has become apparent, vaccination rates have increased by 500% in the county and 30% in the state. It's remarkable. As soon as people realize what they're really dealing with, the choice becomes obvious. Unfortunately, this isn't quite the success story that we have in Stapleton, and it's not a story that's over like the one in Stapleton is. As of yesterday, there are 4 more cases in Multnomah County, Oregon. There's also 1 more case that's happening in this adjacent county north. So unlike Stapleton, we have people leaving these communities, these hotspots, and going towards other ones. We know that vaccination rates in Washington and Oregon are very low, and so there's a very good chance that we're going to hit more of these pockets and this disease is going to spread further. So this is what we're dealing with in the United States, and when the World Health Organization reported on this, it also reported on other outbreaks happening in other places in the world. And I want to take you to another example where things have gone worse than Washington, and that's Madagascar. Madagascar, as of 2017, had a 58% vaccination rate. And it's important to note that a lot of this doesn't come down to philosophical exemptions. It comes down to accessibility. People can't get the vaccines. The outbreak began October 2018 in the capital. Again, a single case is where it starts. Look at how this changes over the next several months. In November, we have 3,000 cases, no deaths. December, 15,000, no deaths. January, 19,000. Now we're finally starting to collect the data as it's coming to us. It's coming to us slowly, but we're now getting a larger picture. 66,000 confirmed cases, 922 deaths. And I want to point out that because it's hard to collect data in this region, the reported cases are likely 10% of total cases. Yep, that's measles. So we're looking at 66 to 660,000 cases. For reference, Madagascar has a population of 27 million. That means between a 1 in 500 and 1 of 50 of the population currently have measles. And notably, the case fatality rate is increasing as well. Now, there have been some emergency responses. 2.2 million individuals have gotten their vaccinations in the time since. Again, that's a huge proportion of the population. But the World Health Organization stressed that this situation is still evolving. We don't have the final numbers. We don't know what the total repercussions of this are going to be. This is what it looks like when you live in a place that doesn't vaccinate. It's alarming. It's scary. And for that reason, for reasons like Washington, people are scared. And they're talking from that fear. And it's driven a debate that has gotten very contentious. They're scared of getting, so it's on both sides really. So we have basically people who say, well, the measles could happen anywhere, and I have a kid who's 6 months old. How dare you put them in that kind of a situation? It's irresponsible. There's also a backlash of people saying, look, we still don't have all the facts. We're not going to be scared away by this, and you're taking away from our rights. Like Brianna said, personal liberty is very important. In a survey, actually, while only 7 or 8% of people thought that vaccines were dangerous, about 25% of people think that it should be a parent's choice. So the argument has gotten tense. And it's led to kind of this perspective among the pro-vaxxers. So who are these anti-vaxxers and why do they hate science? Why don't they believe us? Why do they not care about their kids? And this isn't just a straw man. When we were advertising for this event, a lot of the responses I got were, well, the anti-vaxxers aren't going to listen to your science, or the people who need to hear this aren't going to be there, or in an extreme example, well, I guess the measles is just a case of natural selection. People are angry because they're scared. And it's led to this dichotomy where we think you're vaccinated or you're not. If you're vaccinated, you obviously accept vaccines. If you don't, you're an anti-vaxxer. You're a vaccine rejecter. And what do we think about these anti-vaxxers? Well, they just hate the idea of vaccines, won't even open up the conversation, right? They have these really high safety concerns, and they don't trust their healthcare provider. They know better than the doctor or better than the scientist. This is the idea of the anti-vaxxer that has really developed in our country over the last couple of months as this has gotten more intense. But it's important to remember that there's a huge middle ground. Most people that have concerns about vaccines are trying to learn more. These are people that are proactive. They were thinking about vaccines before they had kids. They wanted to go see their doctor. There was a story of a woman who went and saw her doctor 3 times about her vaccine hesitancy, her concerns. And it's because people know this is important. People know that kids are on the line. And we've done a really bad job of engaging them in a way that's useful. If people have questions, it's important that you respond to those questions, listen to their concerns, build empathy and rapport, because that's the only way anyone is going to trust you. I can sit up here and talk about facts all day, but if you don't buy into the fact that I care about your child and that I know what I'm talking about, all that talk is going to be useless. And even this is kind of a false dichotomy, because now we have these 2 camps and we have some people that just can't decide, right? But that's not the numbers. What we're dealing with in this country is a very high vaccination rate. We're very good about it compared to a lot of countries. And then we have these people who say, we can't do vaccines, Big Pharma's trying to get us, what have you. And these are the people we're trying to talk to or shouting down, respectively, right? But there's this huge middle ground, and these are the people that are saying, I want what's best for my kid. I would love to vaccinate, but I heard this thing from my friend. I heard that it can cause autism. I heard that there can be inflammatory problems. I just don't know, and I want to know more. The problem is that when these people speak up, they get shot down. They get labeled as anti-vaxxers. Would you want to engage in that kind of a conversation if you were the target of that? Would you feel like your concerns were understood if you just got yelled down? And the answer is no, of course not. So we have to think about this. We have to think about why people are vaccine hesitant, and we have to think about when we engage in the conversation, because right now there's a lot of, I'm not sure I'm going to vaccinate my child, and then everybody engages. Everybody knows exactly what this person is about and exactly what the response is, exactly how they should answer. That's not what we're dealing with. As Brianna and Sofina talked about, there are a lot of reasons. There's a lot of literature out there. It's very complex, and a lot of the misinformation is mixed in with good information. And you can see that these concerns can happen at different levels. Things like mercury and formaldehyde questions are pretty specific, right? You can give an answer, reference a study. What about naturalism? What about distrust of doctors? That's a much harder conversation. But what I want to point out is that these are all different conversations. And we have no idea what the person's concerns actually are until they tell us. And so I think it's really important that even if you are pro-vaccine, you take into account how you're having these conversations with people around you. If we're really focusing on saving kids, we need to have an open conversation. We need to acknowledge that we're all moving towards the same goal. So how do we have these conversations? If I am in favor of vaccines and my uncle says that he has a lot of concerns, how do I confront that? Here are some do's or don'ts. Do. Remember, we're all thinking of the children. I've repeated that a couple of times, but it's very important. You know, it's important to say, I understand why you're concerned. I understand what the stakes are. Let's talk more about it. Don't start pigeonholing them right off the bat. If you call them an anti-vaxxer, if you say, oh, I know what you're talking about, you can't be serious, or if you say your data's bad right off the bat, people are instantly going to disengage because it's not a conversation, it's an argument. Do. Listen to all of their concerns before responding. Again, you have no idea what these people actually care about, and it's kind of like going to a doctor with a pot in your head and being told to take some aspirin. It's like going to a doctor and saying, I have this weird thing on my foot and I've heard that it can be very bad, and the doctor says, well, your face is fine. Well, that's great, that's good information, I'm glad I have it. It doesn't answer my concerns, and now I'm pretty sure that you're not listening to me, and that makes me pretty sure that you don't know what you're talking about, because it's my child. We have to understand that people are coming at this from individual angles, and that's what we have to engage. The concerns, not the anti-vaxxer. Set aside time to have a conversation. So often vaccinations will come up in a context of some other conversation. It's some side rail of the conversation. And the temptation when we're in that kind of a conversation is to resolve it completely. And so what you'll see often is people saying, well, no, it's not about thimerosal, that's not there, and also the vaccine things have been debunked, and also the inflammation really isn't a concern, it's just your immune response. Well, this has been a good 10 minutes, I guess everything's fine. That's not how it goes. And if you start bombarding people with facts, they're going to be less likely to accept them. Everybody understands that this is a process, right? People are doing a lot of research to figure out whether or not to vaccinate their kids. So set some time aside. Remember, if this is a kid's life at the stake, you can set aside 2 hours for a deliberate conversation. And when you set it as a deliberate conversation, everybody comes in with the same expectations, that this is something we're going to talk about calmly. We're going to go over the information. If we just bombard them with facts, nobody's going to listen to us. And that brings us to my last point. Offer to do the research together. So often in these conversations, I see somebody say, well, I found this, this, and this, and the response is, no, go do some research. It's not actionable, it's not engaging, and it instantly puts the person in the point of view of being the ignorant person. Realistically, a lot of the people who are for vaccines also don't understand vaccines completely. Like Brianna said, it's very complex. So sit down with somebody and have them bring their research, bring your own research, and sit down and suss it out together. Not only does that help you get more information, but it also helps you build trust with one another, that you're not cherry picking facts, that you're looking at the same stuff and coming to conclusions based on that. It's the only way that we're really going to get people to actually engage, because again, who do people feel rapport with? Their family, their friends, their community members. Scientists sometimes. I hope that I can earn the trust of my friends around me who aren't scientists, but the conversation is much more important than that, because the stakes are bigger than what a scientist can address. This is something that we're all dealing with. So in conclusion, I just want to ask everyone to really think about this conversation in times that you have had conversations about this or conversations like it, other controversial topics. And just remember that, it's really important that we don't alienate the people that we disagree with, especially when our health is at stake. Because it's herd immunity, it's community immunity. It's all of us. And if it's going to be herd immunity, we can't afford to leave anyone in the dust. Thank you. And so I'd just like to say that we, having talked about this a little bit, we would really like to be able to provide resources. So if you run into somebody who does have questions about vaccines and wants specific information that you might not be able to access, we really do encourage you to reach out to us with questions. I've also listed a name of somebody who isn't here. This is Lindsay Diamond, who is going to be giving our last talk. She's in charge of an organization called Community Immunity. And it focuses on reaching out to parents that are thinking about whether to vaccinate or not, or adults who are thinking whether to vaccinate or not, earlier in the conversation. So it's not at the point where they're talking to their doctors and getting asked, are you going to vaccinate or not? It also provides a lot of very useful resources. And outside of that, I'd just like to answer any questions or concerns you have either about vaccines themselves or kind of the national dialogue that we're dealing with right now.